Good afternoon or good morning, depending on where you're at. Welcome to our webinar. This is Jana Langhorn. I'm the Senior Director of Marketing at CynergisTek, and I will be moderating today's webinar. David Finn and I would both like to thank you very much for taking the time out to join us today. I see we still have a few people dialing in, but I want to go ahead and get started because we have a lot of information to cover today. But before we get started, I want to go over a couple of housekeeping rules. So everyone will be on mute throughout the presentation, but you will be able to ask questions throughout the presentation by using the chat function. And if you could just change it to organizers and panelists only, and then towards the end, for about the last 10 minutes, we'll go through the questions that have been sent and open it up for questions. And I also want to let everybody know tomorrow or the next day, we'll be able to send out a recording of the webinar along with a copy of the presentation. So with that said, I'd like to go ahead and welcome David Finn. He's our Executive Vice President of Strategic Innovation here at CynergisTek. He has been involved in leading the planning, management, and control of enterprise-wide mission-critical information technology and business processes for more than 30 years. His unique experience in risk management and control objectives of technology, including audit, security, and privacy, allows him to have a distinctive perspective in the design and implementation of business applications and the processes that technology must support. With that, I will turn it over to David.
Thank you, Jana. I'm at that age where any introduction that is short enough to sound like an introduction rather than an obituary is a good thing. So I appreciate you keeping that short and sweet. I am happy to tell you I have had the opportunity over many years in the industry to do webinars from some very interesting locations, including the back seat of a Jeep in Memphis, Tennessee in the middle of the summer. But today I am coming to you live from Hollywood, California. And so you may be present at the birth of a star, who knows? I want to tell you a little bit about CynergisTek before we get kicked off. We've been around almost 15 years. CynergisTek's name is not an accident. It came from the idea of synergy from our two founders. But more importantly, we exercise that synergy today with our customers. And so you'll see that today in our annual report, how working with our customers, we were able to get something bigger and better for the industry. We are about consulting and providing security, privacy, and compliance services to the industry. And we are, like the radio station ads say, all healthcare all the time. So that is our focus, and that's what we do. Now, this year's annual report took a decidedly different approach from our previous annual reports and focuses really instead on a key question that many boards and executives in healthcare are asking today, and that is, how ready are we for a cyber event? It is certainly a question that we hear regularly and very clearly from the organizations where we work. And every year during the first quarter or so, every security firm, whether they make security products or provide security services, issues their annual report. And usually these are related to the previous year, which is the case with our report. But we notice that they are pretty typically doom and gloom. How the threat landscape has gotten more dangerous and how woefully unprepared we are, particularly healthcare, is unable to function in this new world. So this is what we're going to talk about today, our annual report findings. And I'm really going to start out by talking about some of the discussion we had internally, some of the things we learned and want to share with you about these assessments, having done them across hundreds of customers. Then I want to talk a little bit about NIST, CSF, and not only enterprise risk management, but some of the other issues that we discussed internally. Then we're going to get into the meat of the findings, the deeper dive. And as Jana said, we're going to open it up at the end for questions from you. So we recognize that it's difficult, particularly in healthcare, for many reasons, some good and some bad, to achieve the kind of security that we would all like to be able to provide for our organizations. But we wanted to try to actually move the dial this year, not just tell everyone how bad it is and how much worse it's going to get. We wanted to answer questions to actually provide some useful information. And so we focused on one question. We wanted to try to answer this question: how ready are we for a cyber event? And we wanted to do that with this report by using the NIST cybersecurity framework as the benchmark standard. The sample represents the customers we looked at, represents the entire continuum of care, including business associates. It includes everything from critical access hospitals to large academic medical centers. It represents rural medical centers to large multi-state, multi-hospital systems. We started by aggregating the data from hundreds of NIST CSF assessments that we conducted during 2017. And the maturity ratings are then dissected by multiple criteria: the size of the organization, by revenue, by type of organization. And we allow multiple perspectives on the data in this way, looking at the subject from different perspectives. It's important to remember that these are averages, though, across several hundred entities, meaning there are some entities that actually did very well, some that did not do so well, and many that were really somewhere near the mean. And all of the subjects of this analysis, I have to tell you, were also measured against the HIPAA security rule. And against the HIPAA security rule, they turned in markedly higher results than against the NIST CSF. But we have to remember that HIPAA measures an organization primarily for compliance purposes, which, while it's still very important, compliance does not deter or protect against modern cybersecurity threats unless your attacker is an auditor. The HIPAA security rule is narrowly focused. It's overwhelmingly concentrated on confidentiality, and it's more than 15 years old with no updates. It is not a framework, nor is it an industry standard, and it really isn't sufficient to base an organization's cybersecurity readiness on. The NIST CSF allows us to measure more holistically an entity's readiness to deter, to detect, to respond and recover from cybersecurity incidents. Understanding readiness was our primary goal for this report, using an industry-vetted, comprehensive, and contemporary standard. It really is time for us to change the dialogue and our approach to information security in healthcare. The focus going forward needs to be predicting where the threat is going and on improving our readiness posture to effectively protect systems, data, and patients. Now, based on our assessments for 2017 and using a 6-point scale, it was a range of 0 to 5, ranging from 0, which is incomplete. They really don't have anything in place in that particular subcategory, to 5, which is an optimized process. And that means the process is defined, it meets its outcomes, and is continuously improved to meet relevant, current, and projected business goals. We determined the national average and then broke the details down based on organization type and size. Looking at all the data, we see an average or mean of 45% conformance with the NIST CSF. Assuming that the maximum potential is 100%, our average of 45% is not a particularly promising sign. While the NIST CSF is only 4 years old, the HIPAA security rule will turn 13 this year, and healthcare is still catching up. Because we had a significant standard deviation, which you see here at 26%, we know that we had a broad distribution above and below the median. And that was clearly identified in our findings in the data. We had some very high scoring, high performing organizations, and some that had really barely moved the dial on the NIST CSF. The report represents and shows a sobering analysis of the results across hundreds of assessments, representing hundreds of individual hospitals, clinics, ancillary facilities, payers, business associates, and so on, against the NIST CSF. And it tells us that despite over 10 years of regulation, there is still considerable room for improvement in cybersecurity. Those same organizations overwhelmingly received passing grades against the HIPAA security and privacy rules when measured for compliance, demonstrating once again, we've all heard it, compliance is not security, nor will it protect your health system from a cyber incident. The clear message here, once again, is that as an industry, we're not equipped or prepared to address cyber threats or incidents when they occur, or even identify where those risks may be or recognize them when they happen. And while the aphorism that a rising tide lifts all boats might bring us some comfort, in the world of cyber risk and threats, it is unfortunately probably more accurate to invoke a different maxim, and that is a chain is only as strong as its weakest link. Now, it's not uncommon to hear healthcare security practitioners and even professionals in other industries express concerns about how far behind healthcare is in cybersecurity compared to other industries and critical infrastructure sectors. And the concern really resonates in a lot of ways, I think, both personally and professionally for us, because we're all patients. No one wants their personal information like social security numbers or diagnosis or birthdays or addresses compromised. But it has been an ongoing challenge to determine the status of healthcare security for most of them. Most trade and private organizations have attempted to produce surveys that try to quantify this. But the biggest challenge and the unaddressed issue to date is that there's not been a standardized framework used across the industry. And it is frankly time to have a common framework and do what we need to do, which is protect the patient's information, and provide the best possible care, reliably, predictably, and without interruption. Now, on a positive note, it has drastically improved our ability to measure the infrastructure since 2013 with the development of the NIST CSF to help critical infrastructure sectors and organizations reduce and manage cyber risk, regardless of their size or the sophistication level around cybersecurity. And this report reflects the first real analysis across the industry with a consistently applied standard for assessing. It isn't a self-assessment, and I have to point out that of the 16 critical infrastructure sectors defined by the Department of Homeland Security, only healthcare has not officially or formally adopted the NIST CSF as their framework. Cyber risk is really about measuring your preparedness and your ability to identify digital and physical assets and how they're connected and how they're used. It's about being able to protect those assets. It's about being able to detect cybersecurity events by implementing the appropriate measures and controls that allow you to monitor and to detect anomalous activity. It's about the ability to respond and recover when you do have an event. And in this age of hyperconnectivity in healthcare, your security is only as good as the security of the weakest link along the continuum of that data. The NIST CSF consists of standards, guidelines, and best practices to manage cybersecurity-related risk that is a risk-based framework, unlike other frameworks. Additionally, the NIST CSF is prioritized, flexible, and it's cost-effective approach that helps promote the protection and resilience of critical infrastructure in healthcare. And this is coming back to the question of how ready are we for a cyber event. I'm not going to read all these bullets about the NIST CSF. You probably know them as well as I am. But together as an industry, we really can have a standard that we measure ourselves against with a common language to share and communicate security risks and security practices. We can finally improve healthcare through better capabilities in protecting patients' data and the clinical and financial platforms that we use to deliver care. We can have an enhanced collective understanding of the state of cybersecurity collaboration and our understanding of it across the industry. We have greater intra-sector and cross-sector and even international cybersecurity collaboration and understanding because we see great uptick of the NIST CSF, not only in this country across other sectors, but internationally. We have improved internal and external oversight and due diligence for third parties or business associates and vendor risk management. We have improved senior management and boardroom engagement. We have reduced administrative and regulatory compliance complexity by using the NIST CSF. We have more efficient and effective resource collaboration and allocation to address risk. We can have better innovation for technology companies who have a clear and common understanding of the requirements around security. And most importantly, protecting our patients' information so we can focus on delivering safe, uninterrupted care. Because at the end of the day, this is about security, but in our business, security is about patient care and safety and the quality of care. Now, I want to talk about enterprise risk management. I mentioned it a little bit, and the NIST CSF is a risk-based approach to security, but it has to be an enterprise risk management solution. You can't look at the IT risk and let IT deal with it. IT may not understand what the business risks are. And enterprise risk management is not a term or really a process that is understood or fully implemented by many healthcare organizations. Executives will talk with their risk officers about malpractice or other types of litigation liability risk. And they talk to their compliance officers about fraud and abuse risks. And they talk to the privacy officer about privacy risks, or the CISO about information technology risks. But the concept of enterprise risk management is really strategically assessing all the different risks that the organization faces and understanding the implications and interplay of all those risks. It allows for a deeper and better understanding and, frankly, more strategic planning about how to address risks through common risk mitigation methods. You don't have the privacy people trying to solve one problem and the security people trying to solve a related problem in a very different way. But because healthcare organizations have not traditionally viewed risk across the enterprise, but rather in this more segmented fashion, information security risks are thought of typically as an IT issue. And while we're beginning to see that evolution is occurring, it still is not a common practice to review or view risks in the more holistic context of enterprise risk management. By approaching it through this enterprise approach and bringing all areas responsible for risk oversight to the table, the organization will have a fuller picture of risk and will have better solutions for addressing those risks. When thinking of information security risk, it's easy to fall into the trap that this can all be handled through technology. However, that is not the case, and it can lead to missing the implication of information security risk to other areas of the organization. If an organization has an information security incident, for example, it will lead to implications in a number of other components of the business. We've seen elective surgeries canceled, for instance, because of a cybersecurity incident, and that results in a reduction in revenue. It increases the time lag to get changes submitted, which will lead to a lag in payment, which have implications on cash flow. We have increased risk of staff cutting corners as they're asked to do work in a less efficient manner because systems are down, which increases compliance risks. We've seen increased medical errors because of downtime procedures are initiated on paper, and that makes it more difficult to communicate changes in the patient's condition or to calculate drug dosages. We see increased unanticipated costs to recover from a data incident, provide notification to impacted individuals, or even hire external parties to assist. And of course, there's always increased stress on the staff who are operating in a more chaotic environment when systems go down and things don't work as they're expected to operate. When you start to look at this from an enterprise risk, you begin to look at privacy in a different way. It's often said that you can't have privacy without security, but the traditional approach to privacy assurance has been that assurance approach. You write the policies and you write the procedures, and then someone has to figure out how to enforce them, how to monitor them. So it's been a focus on protecting people from the harm of unauthorized disclosure in compliance with the privacy rule or other regulatory requirements. However, the current compliant-based approach was developed in a response to an environment where health information was really managed and controlled largely by that single organization. And there was a health information management department that kept the charts, and they knew where they were and they knew who they went to. And even when we moved to electronic records, there were access controls and monitoring of who was looking at what data. But new approaches to collecting and using data about an individual and how they're using information networks suggest that this risk-based approach may improve the ability of healthcare organizations to more effectively handle personal information that they create, that they maintain, and that they share inside the organization and outside the organization on a daily basis. Advances in user and entity behavior analytics provide powerful tools that use machine learning capabilities and artificial intelligence to increase accuracy and to enable healthcare organizations to track and analyze data access. And these solutions, in turn, allow an organization to focus their attention on protecting patient confidentiality as they add technologies with unidentified vulnerabilities and enable secondary collection and uses that may pose a risk of compromise or harm to the individual. So you have a better view of what's going on with the data, how it's flowing, who's using it, and what they're using it for. And these technologies provide dynamic tools that allow you to identify anomalous behaviors with a great degree of accuracy and a lot of flexibility in near real time. UEBA employs advanced analytics to better process these behavioral analyses, and they are proving to be highly effective where we've seen them in use at customer sites. They're effective in exposing insider threats, still a huge issue in healthcare, hijacked accounts, and compromised credentials, also a very high level risk and an active risk in healthcare. It monitors user accounts and works with endpoint devices or embedded applications on your network. And it's also a learning system, utilizing machine learning capabilities to build higher accuracy and sensitivity over repetitive use. As a complement to its extensive guidance for information security, NIST has actually developed a systems engineering and risk management approach for privacy that can help organizations address privacy concerns from the collection and uses of data. To help organizations conduct privacy engineering, NIST actually developed a set of objectives to help focus on the types of capabilities that information system administrators have implemented. The NIST project also introduces a privacy risk model to enable organizations to conduct privacy risk assessments based on the likelihood that an operation performed by a system could create a risk to confidentiality when processing personal information, and the impact of that action should it occur. So again, we're beginning to see this integration of risk management across the industry. We've for too long thought of privacy and security as separate components, and it really is kind of the mirror image. They need to be done together. So those are kind of the insights we talked about, some of the things we were seeing across the sector as we looked at the NIST CSF data and what people were doing with their NIST data and the information they were collecting using the NIST assessments. But now I want to finally get into the data. I've been sharing our insights about that data, but going forward, you'll see the actual data that we use that helped us derive some of these insights around enterprise risk management and new ways of managing privacy. So the industry, and here you're looking at the first data here, and this is the conformance with the NIST CSF by organization type, starting with physician groups, hospitals and health systems, and business associates. So the industry has long recognized that critical access hospitals have the greatest struggle in achieving compliance with both the privacy and security rules. They are also probably the most lacking in financial and human resources. Their focus is just keeping the operations up and running. It will be important that organizations that connect to and share with those critical access hospitals understand what is actually in place at those organizations and where the risks are. And this was very promising to me, the business associates being at 59%, a very high compliance level. But don't think your third-party risk problem is solved. It frankly is just beginning. The business associates that have the financial wherewithal and the presence of mind to seek out a third party to do a security assessment are way ahead of the curve. And they really, our business associates don't represent the broad arrangement of business associates. HHS several years ago estimated there were 7 million business associates in the United States. I can assure you we did not do a significant sampling across those 7 million. The good news is of the ones we did, they are ahead of the curve. But again, it was a limited, specific subset of the business associates, but a good start. Looking at the conformance by hospital type, not surprisingly, the smaller the hospital, the smaller the organization, the lower level of NIST compliance or conformance. And this should be a reminder that we're all connected and that while your organization may have many of the NIST practices and guidelines in place, connecting with organizations that have less security raises your security risks. Now, you could argue that organization type and hospital type are to a great degree a reflection of headcount. And while there is some correlation, we're going to look at that data in a few minutes, there is not necessarily causation. Not all academic medical centers are massive in terms of bed count or head count. And as we digested this data, we found, as I mentioned, that those organizations that had an enterprise mindset performed better. So as you look at what's going on here, a critical access hospital, it's hard to think of as an enterprise, even if you're in it, because you're the ER doc, you're also the HIM director, and you may have some IT responsibilities. So it's very difficult to look at it from a highly integrated perspective. You're just trying to get through the day solving problem after problem, where an academic medical center really kind of has an enterprise thought process already in place. So we believe this is one of the issues involved here, is moving to this enterprise risk management, not saying this is that problem and so will fix it and that problem will get fixed by someone else, but looking at the problems more holistically. When we get into the conformance by number of employees, we start to see some anomalies. In the next several slides, I'll point some more of those out. But what we found is headcount may count, but only up to a point. More people might interpret, you might interpret as having more money and resources, but we see some interesting shifts on the higher end of the scale in some of these areas. And these may not be significantly, statistically significant, but they are an interesting data point to look at. And as we move forward through time, we'll continue to look at this information and see what's going on. And as we dig deeper into categories and subcategories of NIST, we may be able to get some additional insights. But at organizations with fewer than 500 employees, we see a tremendous lack of basic security. And this is not surprising when you think of how many healthcare providers and even business associates fall into that category. But the problem for the rest of us is many large organizations connect with them. And so seeing those organizations with 500 or fewer employees at only 20% conformance with NIST is a very disheartening number, something we all need to be aware of and something we need to help those small providers, those small business associates with as we go in to connect with them, to share information with them. You do see that we kind of hit a sweet spot at the 5,000 to 7,500 employees, and then it actually slides back. Again, maybe not a statistically significant number, but we hit the optimal number of conformance at organizations with more than 10,000 employees. Bed size helps too, but again, within a range, kind of an interesting anomaly here. A similar glitch, if you will, in bed size. Optimum conformance happens at systems with more than 2,000 beds at 66% conformance, but close behind them is the facilities that have between 250 and 500 beds at 61%. And in between those ranges, you see between 51 and 55%. And this may indicate, again, it's a single data point, certainly not a trend, but this may indicate some sweet spot on conformance by bed size. Maybe 250, you're still small enough to be able to share information quickly, to have very standard approaches. Everyone knows each other. They know how they're doing things at 500 beds, and then you get into the area where it's bigger, it's harder to get your arms around. You may be at multiple locations. And then at the greater than 2,000, you're probably a system. You probably have codified rules. You probably have better enforced standards and ways of addressing some of the privacy and security issues. So that's what we're seeing in terms of bed size. In terms of revenue, interestingly, revenue is not necessarily a good predictor of better security. This was a surprise to me. Organizations with less than 50 million in revenue scored significantly higher than those in the 50 million to 100 million range. Organizations in the range of 500 million to 1 billion in revenue scored higher than the next two tiers and higher than any other revenue range. That's the 750 million to 1 billion. Bigger in terms of revenue, I guess, isn't always better. What makes an organization better is focus on the problem. And while the question we're trying to answer is, are we ready for a cyber event? The answer isn't to put all your eggs in one basket into the incident response plan. The best way to deal with an incident, frankly, is to not have one. And that means you're regularly doing risk assessments. You are reporting progress. Your policy and procedures are up to date, and your organizational structures are effective and reflect the organization. You're looking at risk from an enterprise perspective, and that you have inventories and you know the security and risk posture of your devices, of your network, and of your data. You can identify and authenticate users, and that you know who users are and what they're entitled to have access to and what they can't. And you know when all that is happening. So again, it isn't just the money, it's the focus and the attention you're paying to the problem on a daily basis, a recurring basis. So the lesson that I learned is money matters, but not as much as we thought. Now, drilling down into the NIST CSF itself, we looked at the core elements: identify, protect, detect, respond, and recover. The protect function supports the ability to limit or contain the impact of a potential cybersecurity event. An average of 2.2 indicates another area of significant improvement. Across the board, the lowest ratings were in the detect function. And the detect function enables timely discovery of cybersecurity events. Examples of outcome categories within this function include anomalies, events, security continuous monitoring, and your detection processes. And the average here of 2.1 indicates really significant need for improvement across the sector if you want to be ready for that cyber event. Understanding that events will happen and that no one can prevent every incident, response should be an area of more focus. It will be critical to almost every organization at some point. The rating of just over 2.5 indicates most organizations are not prepared to respond comprehensively to a cyber incident at their organization. Digging into the data a little deeper, we find that physician groups lag both hospitals and health systems and business associates. Based on our set of assessments, business associates lead hospitals and health systems in NIST compliant, but it should be noted again that these are business associates who actively sought security risk assessments in 2017. Again, this is a deeper dive across all 5 core elements, not overall conformance. There are no real surprises here, but some variance and some nuance that is interesting. If you look at critical access hospitals, for example, from a 1 in detect, a 1.0 in detect, which is frankly pretty abysmal, to a 2.2 in the identify category, which is really not far off from the rest of the pack. Or if you look at organization type, the business associates are better than any other type in the recover area, any other type of organization. And that certainly is not our typical understanding of business associates ahead of all hospitals and health systems. We had some pretty major business associates over the last 12 months have significant outages that took what most customers would call excessive time frames to recover. So again, maybe an anomalous number here, but something worth looking at. And then jumping from organization type to hospital type, we see that physician groups are pretty even with critical access hospitals, except where the critical access hospitals are at a 1.0 and the docs are at a 1.7. I'm not sure what that means. It could be there's smaller environments, there's less hardware and software, and so they have a better handle on detecting things that aren't going right for them. In terms of identify, though, the critical access hospitals are ahead 2.2 to 2.0 in that area. And as we drill into the core elements, we noted the single highest conformance level was recovery in hospitals and health systems with more than 2,000 beds at 3.2. And that is really moving into optimization of your processes. That means you have a closed loop. You're taking feedback from what you're doing and improving your ongoing processes using your own data from your own work. On the employee side, based on employee size, if you drill down, we top out at 3.0 for recover when we hit organizations with more than 7,500 employees. Now, the next tier really doesn't get you anything. They're in terms of recover, they're both at 3.0. But moving back to respond, going back in the processes one level according to the NIST flow, we go from 2.7 for that under 10,000 to a 3.0 for those organizations greater than 10,000. So again, a data point, certainly not a trend, but something worth watching as we go forward. Looking across all the elements, we see in 2017 we saw these anomalies here in terms of conformance with the NIST CSF. So bigger may not always be better. Money does matter. It just doesn't matter, as I've said, as much as we thought as you're looking at revenue. So again, we top out at in terms of almost all areas at the 750 million to 1 billion in terms of revenue. And we actually have some step downs after we get to the $1 billion number. Again, it's a starting point. We'll be looking at this going forward, but it is an interesting anomaly or glitch that I did not anticipate as we started collecting this data. Once again, in 2017, we saw an overwhelming number of cyber attacks take advantage of obsolete systems and software, mistakes, and lack of attention in administration and maintenance. It's bound to happen. Most attacks started with the attacker finding a system that was no longer supported. It wasn't configured properly. It had an unsafe service running, or it wasn't appropriately patched, which gave the attacker the door they required to begin their attack. And this isn't surprising, since we saw that the number of vulnerabilities identified in systems increased 31% in 2017 over 2016, which set another record according to Risk-Based Security's latest report. And an even more sobering statistic in that report is the fact that 24% of the vulnerabilities identified had no known fix. The most significant realization was in how the threat was and is shifting to focus more on the newest and largest attack surface, which is people. People are now connected to the network in more ways than ever before, and as healthcare embraces more patient-centric models, incorporating a countless number of devices that enable point of care at the patient, these devices become new avenues for attack. Devices were commandeered by IoT botnets and used against the very entities that own them. We saw incidents that involved direct attacks that sought to exploit human vulnerabilities like phishing. We saw the instance of malware attached to those emails increase to 1 in 131 emails over the course of 2016. So user awareness is still an absolute necessity, and most entities had some form of proactive user training for the phishing threat. But despite best efforts, incidents continue to occur. So training alone is not going to solve this problem. One of the core functional areas that's key to defending against cybersecurity threats is the ability to detect. And this includes monitoring tools such as security information and event management SIMs, intrusion detection and prevention systems, IDS and IPS, as well as antivirus solutions. A company is hit with ransomware every 40 seconds somewhere in America. So without a doubt, malware, and in particular ransomware, is and has become the main stage actor in the world of cybersecurity attacks. Everything we see says that's going to continue. The attacks have gotten more sophisticated, costlier, and more disruptive over time. But the very infrastructure that it relies upon in the ever-growing supply chain is part of those hackers and attackers' operations. Healthcare organizations are under constant attack from ransomware and malware, according to surveys of healthcare providers, and reports of breaches led the HHS Office of Civil Rights reports this year. They reported more than twice as many incidents of ransomware and malware as the primary cause of breaches of EPHI in 2017 over 2016. Attackers devised numerous variants of ransomware and malware strains, which caused substantial downtime and financial loss for victims across many industry sectors, including healthcare. We saw what happened to the National Health Service in England, and a recent study of their outage last year from WannaCry and NotPetya showed that 20% of those organizations still were not in a position to protect themselves from a similar attack. Now, it's widely accepted that cyber attackers are constantly probing information systems looking for opportunities. The crucial differentiator between the healthcare organizations that suffer a debilitating attack and those that succeed in maintaining critical information system operations is having strong, defined controls in place so they can identify, isolate, and respond to an incident. And the NIST CSF has really emerged as an essential tool in identifying and assessing the effectiveness of information security measures. Based on our own findings included in this report, only the very largest by employee count, the largest organizations routinely achieve a score of 3, which means they have an established process. 3 is kind of a C. You're doing okay in the respond category. This was reiterated in the bed size measure, as hospitals or systems with more than 2,000 beds were more likely to achieve a rating of 3, which is really kind of the floor in terms of being able to protect yourself. Revenue is a mixed bag, as we talked about, but inconclusive. Maturity ratings varied by only 0.3% for organizations ranging in revenues from $750 million to over $2 billion. So some of the lessons we learned as we looked at this and looked at organizations that had attacks, when board members asked the CIO questions about the provider's ability to recover, the answers tend to focus on the clinical systems from backups. How do you recover clinical systems from backup? So we need to exchange that, because that you can get the data back, but you still have to rekey records from during the downtime. And we've also seen an increase in litigation following a privacy or security incident. And the early attempts at litigation were not successful, but we are seeing a recent shift towards proving negligence being accepted by the court. You don't need to prove negligence to have your case heard. You just have to have the event. So privacy and security response should have strong legal oversight. Your incident response plan also needs to take an enterprise risk approach. Incidents happen for a reason, and boards should insist on, again, comprehensive root cause analysis. And the last lesson is to recognize that incident response has to be an enterprise issue, not an IT issue. This is kind of the link. I'm trying to wrap up quickly here, but if you want to get a copy of the report at our website, you'll find a place to download that, and we'll be there will be an email, a follow-up email going out tomorrow, which will include the link to the download site as well. So this report really did several things. We wanted to create a standard, and we believe together as an industry, we now have that in this CSF. And it gives us the ability to measure ourselves against using a common language to share and communicate security risks and security practices. We can finally improve healthcare through better capabilities in protecting our patients' data and the clinical and financial platforms that deliver care. This is about protecting your patient and your patient information so you can focus on delivering that safe, interrupted care. CynergisTek hopes that this report will bring some clarity and some insight to this vision as we evolve into the future of healthcare. And we hope that everyone on this call will join this journey to a more secure, a safer world for all of us as patients and professionals. And I think I'm close to time for some questions. Jana?
Thank you, David. So I've got, again, as a reminder, we've got the chat function where you can submit any questions that you would like to ask David. Otherwise, I'll start going through some of the ones that I've seen so far and throughout the presentation. So my first one for you, David, is I'm going to kind of paraphrase this. So how do you make enterprise risk management across the culture when the culture is currently that it's IT's problem and only IT's problem?
Yeah, that is the $64,000 question. I was actually hopeful when Hollywood Presbyterian had their ransomware attack because what that did was it didn't shut IT down. IT was very busy. What happened was providers couldn't get to the charts. Physicians couldn't write orders. The billers couldn't drop bills. The coders couldn't update charts and get bills out, and nurses didn't know what flows were going and where patients should be. So this is an enterprise issue. Whatever causes the cyber outage is a business impact, not just an IT impact, or maybe not even an IT impact. So it's telling that story to the board and the senior executives in a way that resonates with them, not talking about it from a security perspective. We need to update the operating systems on your medication dispensing cabinets on the floors because we're doing a network upgrade and we can't run AV on them. No nurse would ever vote for spending money on that. But if you tell the nurse that if we don't upgrade the operating system on the medication cabinets with this network upgrade, the network cabinets will shut down as soon as something hits them, and you will have to add whatever X number of additional nurses to each shift in order to maintain your same level of medication services on those floors during the outage. It's turning the impact from an IT impact to their business impact. And that is going to be different in every organization. Their risk appetite will be different, but it's talking to them about their business, not about what it's going to do to IT.
All right, thank you, David. And then the next question I have for you is that, we know that an event is going to happen, so why wouldn't we just focus on the recovery piece of it and being ready to recover from that incident, since it's not a matter of if, it's a matter of when? Yeah,
I actually hear that sometimes from poor beat up CISOs who say, I can't do everything, so I'm just going to focus on my response and being able to recover. And of course, the best way to deal with an incident is to not have it in the first place. So that really is about doing, and I hate this phrase, but it is kind of the standard. That is about basic cyber hygiene. That is about patching. That is about updating. That is about your routine and regular training. That is about managing the life cycle of not only your hardware, but your software, because I hate to say it, but software wears out too at some level. And it probably isn't even stuff that IT needs. I remember when I implemented Epic, and one of the Epic account managers brought in my log on and user ID for Epic, and I'm the CIO. I said, tear that up. I don't ever need to use Epic to do my job. So it's talking again to the business and getting them to understand what their issues are. Because the more you can do up front to avoid the problem, the better off you're going to be. You're going to find the problem sooner. You're going to lessen the impact of the problem and reduce the scope of that issue if you're doing all those things on a daily and regular basis. That doing all those things right doesn't mean you still don't need an incident response plan to go with it, but you kind of, and this comes back to the NIST CSF, it's not ever one thing. Complex systems fail in complex ways, and so you need to be able to recover them in complex ways across the organization.
All right, and then here's a great question for you. One attendee wants to know, based on the findings and the data, what would you recommend to be the top 3 specific focus points that hospitals should take in 2018?
Wow, that is a good question, and I will start at the very beginning, and that is identify. One of the things we still see pretty much across the board is no one really has a good inventory of what they're trying to protect. So I'm not talking just about the hardware and the software, and when I say hardware, that's everything. That's your network hardware, that's PCs, that's all the devices that attach. But where we see huge gaps is in printers, and we're seeing printers used more and more as a point of attack, and B, a point of data leakage, because those printers can be, they're printing stuff that you don't want. It winds up on the device. It winds up coming off the device. It's stored on those drums. Printers have an incredible amount of storage on them. So the first thing is inventory, and that includes all your compute environment. It includes your printers. It includes your biomedical devices. Most people have no idea what is out there in terms of medical devices, where it is, how it's being used. They can't even tell you if there's EPHI on the device, which gets into the privacy aspect of it. And last but not least, IoT is coming to healthcare in a big way, much faster than we're prepared to deal with it. So I'm talking about security cameras. I'm talking about things like Amazon Echo in patient rooms, which is a great patient service enhancement, but you're now connecting a inherently insecure device to your network, and you've got to have visibility into that. And that means understanding your inventory, and once you've got the inventory, understanding the risk and risk rating all those devices. So inventory is one. The other one, and I called it out, the low score there, the 2.1 in respond. Let me see if I can get back to it real quick. No, I think I passed it. I'm sorry, in detect, we're not doing a good job of finding stuff when it does happen. That's kind of continuous monitoring and the tools to do that. And a lot of people have a lot of tools. The trick is getting those tools to talk with themselves. And it was the buzzword at RSA, orchestrating security or building a single integrated model. When we did EHRs many years ago, we interfaced a whole bunch of systems, and we discovered that interfacing was not the same as integration, and that's kind of where we are with security. Detection will be enhanced if you can actually integrate your DLP solution with your encryption solution, with your malware solution, with your firewall. You begin to see things and anomalous behavior that you might not have noticed otherwise. So identify, detect, and then the next thing is really we kind of get into respond and recover, because as I said, the bad stuff is going to happen. There's no way to present it. Ben Franklin said it better than me. If you fail to plan, you are planning to fail. So again, going back quickly, identification of your assets, knowing what's out there, detection of cyber events and anomalous behaviors, both on users and devices, and then your overall incident response and recovery plan for when it does happen.
All right, thank you, David. And then I think you have a meeting to go to. There's still a couple more questions. Do you have enough time for that, or do you want we can reach out individually to these people?
Let me take one more, and I've got to get into Hollywood for my fans.
All right, so last question I got is with regards to healthcare, what are you seeing regarding the need for the HITRUST certification, and does HITRUST include the NIST CSF?
That is a very good question. And HITRUST, I was a CIO in Texas. I'm way back when HITRUST was just getting started. There was a time when HITRUST was the only solution for healthcare, and CEOs loved it because it was healthcare only. And they did a good job of incorporating other standards like ISO and ITIL and COBIT. But HITRUST is not a framework per se. It really is more of a compliance approach. But because it was healthcare specific, it made sense. When the NIST CSF was born in 2013, it kind of supplanted that. And because it has the full force of the federal government behind it, and not even that, it has the full force of 15 other critical infrastructures that have a lot more margin than healthcare. There's constant update and upkeep to that. NIST has addressed mobile medical apps. They have addressed medical devices. They've addressed things that are so new, HIPAA couldn't deal with them. HITRUST hasn't been able to keep up with those changes. So HITRUST is a great tool for reporting, and if you've been using it, and your board is used to seeing it, it's a good tool. But if you are looking for something that will actually secure your organization and help you talk with your third parties, help you talk with other providers that you have to connect with and share data with, I think we all want to get on the NIST CSF, and ultimately the critical infrastructure sectors will be sharing and using that CSF. So again, when we do cross-sector, at some point healthcare is going to have to share with banks. They're going to have to share with energy regarding. There's been a lot of attacks on the energy sector, and you want to know in advance if your power is going to be out or if your power is under attack. So I think having a common language, a common framework, and being able to understand someone else's security posture buys us a lot of security, a lot of privacy, and NIST CSF makes it easier.
All right. Well, David, I'm going to let you get to your meeting. I want to thank everybody that stuck around for the last Q&A. I know there was a couple more that we didn't get to, but we will reach out offline to get those questions addressed. And for anybody that's still along, we'll be sending out a short survey immediately following the webinar, and we'd greatly appreciate if you could take a few minutes to share your feedback with us. Otherwise, we'll get the presentation to you and a copy of the recording and a link to the report. And again, thank you for joining, and thank you so much, David.
Thank you.
Have a great day.